welcome again to another series of the Medicare Mondays. It's been a pleasure learning through Medicare, learning from Medicare pathways through Part D and through annual enrollment period. It's exciting. It's exciting. I can't even imagine we have gone through five. This is our fifth episode. This is our fifth series within this episode. I can't even imagine how quickly time has gone. But it has been a learning experience to me for me, and I hope it's been a learning experience for you. If this is your first time joining us, my name is Dr. Prince Belwa, and I'm being joined by Ruth Flynn, and she will talk more about herself and her agency and her organization. And you're gonna love just learning from her because I have loved that, and it's been a pleasure. Um, if you're joining us for the first time, we have gone through several series, so you can check it out on our Heals Academy and Health with Solutions Facebook, YouTube, LinkedIn channels. And if you are joining us for the first time too, you can like, subscribe, share, invite somebody because this will be helpful to someone you may know, someone going through this Medicare experience right now, or even have the knowledge for in your pocket so that you are better prepared, not when you get there. And we want to thank you again for joining us because we know that within the hour there are so many things you could have used for the hour, but you decided to spend it with us. So we want to say thank you for joining us. And I am from the Heals Academy, and this is our Health Insurance Made Easy series. And our goal is to help accelerate health equity through health system literacy, and that is one of our key goals. And I will pass it on to Ruthlyn Noel Joseph, and she will introduce herself and tell us more about what she does and health with solutions as well. So Noel, Ruthlyn, sorry, go ahead.
Oh, Prince, good afternoon. And you wouldn't be the first one to call me Noel.
you know, Christmas is always here.
It's my season. It's really my season.
Yeah.
Well, good evening, everyone, or wherever you're chiming in from and watching us. My name is Ruthlyn Noel. My company is called Healthways Solutions, and we are insurance problem solvers. We strive daily to help our customers understand the coverage choices that they're making when it comes to Medicare,
Mhm.
um, health insurance in general for people under the age of 65, or even life insurance. We know that insurance is so complex. And so sitting with someone and taking our time and hand holding them through the process is our motto. And so we're just so excited to be able to do this insurance education program on Medicare, of all things, with Dr. Prince. And so we look forward to enlightening you and educating you today as it pertains to Medicare, in particular, Medicare Advantage plans.
Thank you so much, Ruthland. It's exciting. It's been exciting. I can't even imagine we've gone through several series. And if you're joining us for the first time, as I said, you can always catch up on the previous series in this episode on our YouTube channel and our LinkedIn and Facebook, and it's all over the place. So please do a good job and also send it out. Let people know about this. Today we are going through the series on Medicare Advantage Pathway, Part C pathway. If you join us for the first time, you knew our first video talked about the pathways, and throughout the series over the past through October till last week, we've been going through the first pathway, which has Part A, Part B. And then Part D through all the good stuff. So you can catch those out from the previous video. So we want to go through that, and I have a history of what we've covered over the past weeks. Week number one, Medicare pathways. Week number two, enrollment periods, a whole bunch of them. Week number three, we specified on the annual enrollment period because we are in already. Week number four, last week, we went through Medicare cost. And today we are going through Medicare Advantage, which is the Part C pathway, looking at some of the plans and what they mean. Ultimately today is to go through the different plan types in Medicare Advantage, and we want to help simplify that for you. There are picking up some resources from CMS.gov website and helping it simplify these plans for you. And we want to go through the annual enrollment period because you are in Ruthland. I know we've been covering this and reminding people, our audience, the annual period, which is for Medicare plan enrollees, people that are already in the plan, to reevaluate your coverage, make changes to your coverage, and it started in October 15th, not August, sorry, to December 7th. So November, we're in November, and we are almost about a month to it. Today is November 6th, so we are about a month or a month and just a day through it. So please take advantage of the annual enrollment period if you're a Medicare enrollee. If this is your first time getting into Medicare, this is your initial enrollment period. I learned this from Ruthland. So uh, the opportunity, we go through why we're doing what we're doing because it is an opportunity, and the CMS website has several resources that are being shared and telling you you have the chance to compare your options. Have you done that? And what we are doing is educative, helping you to understand these resources online, these resources around us, and be able to make informed decisions, and also to know that there are professionals like Ruthland that are ready to help you out. You don't have to do this by yourself, and therefore we want to get you educated as you work with the professionals to better make the right choice for your coverage for next year 2024 policy period. Ruthland, I was reading this article, and this is from the Kaiser Family Foundation's article, and talking about Medicare Advantage enrollment in 2023. I couldn't find one for 2024, but one of the key things, which I think it will be much more for 2024. But one of the key things that we saw as we read this, and from what we'll be doing today, it gives us an opportunity for what we are doing. And pretty much what it just covers, if I may read here, it says the average Medicare, I'm reading from here, the average Medicare beneficiary in 2023, um, oh, sorry, 2023 has access to 43 Medicare Advantage plans. Sorry, I lined over it, but 43 Medicare Advantage plan. One person make on average across the country, you have 43 plans to choose from. So that is the largest number options ever. This is 2023,
Right.
and we're in 2024. So we suppose that there's probably going to be increasing, and I can't even imagine giving 43 choices on average and try to make a choice within this initial enrollment period. But that is what we have. These are choices. So the choices are there for us to for Medicare beneficiaries to make decisions. And
And
going further on this, going on the Advantage versus the traditional Medicare enrollment, which is the pathways that we talked about. This is a projection, right? And you can see this is 2021, here's 2024. So looking at the Medicare Advantage taking a lot of the percentage over time, and
mm-hmm.
CBO projects this to be increasing. So the choices are going to be increasing over time. So arming yourself now, knowing how to deal with this, making the choices that you have either from traditional standpoint or Medicare Advantage standpoint is very critical in the years to come and even for now. Another chart that I saw here for the states that are enrolled in Medicare Advantage plan by 2023 by state. So red is greater than 60%. So people in Michigan, Medicare Advantage penetration 60% here. Then 50, you could tell a whole bunch of states are in that 50 range. Then the colors just go down. So you can tell that this is growing, and the choices that beneficiaries will have will continue to increase. And therefore, knowing this, arming yourself with this, having knowledge of this, so that you can make the best informed choice for yourself, either from the traditional standpoint or for the Medicare Advantage standpoint, is very critical. And with that opportunity, I am going to pass it on to Ruthlyn as she takes us on to Medicare Part C, the Medicare Advantage Pathway. And Ruthlyn, I will pass it on to you.
But Prince, you see why the statistics and the numbers, it's increasing, it's going up.
Hmm.
But I also see why there is so much confusion as well, right? When you presented the data, with over, what was it, 45 plans they have to choose from?
43. I think it's,
43.
yeah, 43
And
choice.
it's,
Yeah,
yeah, and it's probably even greater to this year than it was last year, right? In the number of choices. But that's
last
why
year.
people are
Yeah,
failing miserably, is because there's something as having choices, but too much choices causes confusion. I've learned that.
confusion. Yeah,
And
yeah,
so people are confused and they're overwhelmed because there are so many choices, and there are so many different things going on with Medicare Advantage that they just don't know which one to choose. But there's
yeah.
also something to be said. It's true that Medicare Advantage plans have problems, but the numbers doesn't lie. It is growing. There are, what, 62% right now, and
Yeah,
growing, with the people choosing Medicare Advantage plans over original Medicare. So something has to be said that if so much people are, if it's growing, if the market share of these Advantage plans are growing, and we know that some of the
projected to
plans
grow.
have
Yeah,
problems, right? It's not all that bad. And so it really comes down to choices that individuals are making and how they're making choices. And I'll tell you, when someone says to me, well, which is better? Do I stay with original Medicare or do I go with Medicare Advantage? I say it depends, because it really does depend
it depends.
on the individual, on their needs, and what's going on in their lives and their budgets to be able to choose. So it's not good or bad. It depends. What is it that you're
Yeah,
looking for? How do you want Medicare to work for you? So we're going to talk
yeah.
about that. And so we're going to talk about Part C, Medicare Advantage plans, as Prince say. And we go back to the crossroads, right? The choices that we make when we get to Medicare. Original Medicare, which is your Medicare Part A, your Medicare Part B, and then you choose with original Medicare whether you keep a standalone drug plan as well as add a Medicare supplement plan. The other choice is Medicare Advantage. So it's our Part C. And if you move ahead, Prince, to our little slide deck, Part C. Okay, so we covered the original Medicare. So I just explained
Medicare.
it. So we could move ahead.
Yeah, that's what we covered.
Halfway
And
one.
the last went
Yes.
over the part C, having the
The,
health insurance career in the middle between the
correct.
federal government, CMS, and the Medicare
Yes.
beneficiaries, and touch on how does Medicare Advantage Pathway relate to the Medicare and Medicare supplement. Yeah,
Yes. I'm
as
going to
well.
come back to that one in a second. But with
You're gonna come
Part
back?
C, and
Okay.
I'm going to come back to this, how the two merges, but let me explain Part C, because so many
Hmm.
times people think that your Medicare Advantage, which is often called Medicare Part C, I will hear individuals call me and they'll say, "Oh, I have a Medicare supplement," and then I'll ask, "Okay, what Medicare supplement plan you have?" And they will go ahead and start explaining a PPO plan, an HMO plan that they have, and they'll list out the carriers, and I'll have to stop them and educate them that what they have is a Medicare Advantage plan,
Advantage.
not a Medicare supplement plan.
Oh,
Because the Medicare supplement plan, as from weeks ago, what we learned is that it only supplements your out of pocket costs for Part A and Part B. So Medicare supplement only works with original Medicare. Your Medicare Advantage plans are Medicare approved plans that are provided by private insurance companies. And those companies may be the same exact companies that sell someone a Medicare supplement. So you understand where the confusion comes in, right?
so it's the
Because,
same company but different product.
but different products. And
Okay,
they have different intentions on those two products,
product. Okay,
right?
okay.
So when someone has a Medicare Advantage plan, what they have is their complete insurance coverage is going to be handled by that private insurance company.
So
Meaning,
pretty much like someone having, and I'll use this as an example because we all have our phones, but you may see an iPhone and see an iPad. They look similar in some ways. One is bigger
right,
than the other.
right,
They all have touch screens that it works with some apps and things like that. And you may think they are the same because they're coming from the same Apple company,
correct.
but these are different products and different use cases for what you need these gadgets for, correct?
Yes, yes.
Okay. Okay.
They work very differently,
Okay. Okay.
right? So your Medicare Advantage plans, complete health insurance is managed by those private companies. And you know the names. I don't have to call the names, but it's managed by the private insurance companies. And so the hospital coverage that
Hmm.
someone would have under Part A, the doctor's visits that you're going to go see your doctors, the labs you're going to get, right? All of those things are now covered under the Medicare Advantage carrier,
Hmm.
right? Or covered by that Medicare Advantage carrier. However, what sets Medicare Advantage apart from original Medicare are the extra benefits, Prince, that they do incorporate into that plan.
Okay.
For example, under original Medicare, someone may have to buy separate prescription medication plan. That's your Part D.
Okay.
Under Medicare Advantage, the Part D, the prescription benefits come rolled into the benefits.
Into the
So
part C.
so not only do you get hospital coverage, not only do you get medical coverage, you also get prescription drug coverage rolled into those plans.
Okay.
Plus, um, there are extra benefits: dental, vision. Some people need transportation. Some people love the over the counter cars, and the list goes on and on and on of those extra benefits that's offered through Medicare Advantage that's not offered under original Medicare.
Medicare.
And
Okay.
that's where the difference in those two plans goes. So if you don't need dental, if you don't need vision, if you don't need transportation or the over the counter, a Medicare original Medicare with a
Medicare.
Medicare supplement works great for some people,
Okay.
right? And they buy everything else separate, but those are now four plans because now you're going to have dental plans that you're going to buy separate. You have to buy the Part D separate. And all the extra benefits you may have to take out separately. The
Okay.
Medicare Advantage plan rolls those into one plan,
Okay. Okay.
right? And
Okay.
that's the big difference. And that's why so many people are moving in that direction because healthcare costs in general are expensive
Hmm.
and they're racking up, and individuals are looking for ways to save money.
To save money. Yeah.
All right.
Okay.
Um, so when we talk about, and we're going to go into a little detail more, but when we talk about, Medicare Advantage versus Medicare Supplement, we're moving the cost when it comes to Medicare Advantage.
To
And you might understand, how are we doing that? So with Medicare Advantage, you pay very little upfront. So the premiums are going to be lower, right? And you see a lot of plans, you see a lot of commercials where they're saying to you, you may have a $0 Medicare Advantage plan, right? Those are Medicare Advantage $0 that you're paying in terms of premium on top of your Medicare Part B premium, but it's $0.
okay.
The Medicare supplement, you're going to pay higher on the front end. So your premiums are going to be higher from, in most cases, for a very good quality Medicare supplement plan.
Medicare.
Sorry, Medicare supplement. See, even I
You know.
tongue as well. Okay, strike that one from there. So, so with the Medicare supplement, you're going to pay higher on the front end in terms of like premiums. But a good quality plan will save you a lot more money on the back end, meaning when you go to use to see your doctors.
The
When you go to
service.
the hospitals, the Medicare supplement plans are going to pay for those expenses, and you
Mm-hmm.
wouldn't have those out of pocket costs because
Okay.
you're paying a higher premium to not have to pay those copays.
Okay.
Right? With the Medicare Advantage, you're getting a lower premium, but
And
a higher out of pocket
out of
cost.
pocket cost once.
But there is a piece in the Medicare Advantage that's not part of original Medicare, and that is what's called the MOOP, or basically it's the annual limit that you're going to have. You're going to have a maximum out of
No,
pocket limit on the Medicare Advantage. Once you've reached that amount, whether it's $8,500 or $7,600 or $5,500, once you've reached that amount, you have no more cost to pay for the rest of the year.
okay.
Right?
From what I remember last week, there was some part of the I think was it
Part
the
D. We're talking
Part D
about the
that
MOOP
had,
for
yeah,
Part
with
D.
some more for Part D,
That's a
but
separate one, though.
that's a separate one. Okay,
Yes.
okay, yeah. So with this one, the maximum out of pocket cost and the cost sharing
It
processes,
varies.
it varies dependent on the 43 plans, average 43 plans. They all vary within each plan, right?
It varies based on the plan. Here's
The
what I'm
plan,
going to tell you. A,
yeah,
a $0 plan, a $0 premium Medicare Advantage plan is going to have higher out of pocket cost sharing
cost sharing.
than a plan that's $100, for example.
Okay,
So the
okay.
more you put in, the less you're going to shell out of pocket.
On the out of pocket, yeah.
Correct.
So then you make a
Right.
decision on that. Yeah.
Correct.
Okay. 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 Awesome. Awesome. Awesome.
Okay, so I
Yeah.
wanted to make sure we're pointing out the differences here between the Medicare Advantage pathway and the Medicare supplement.
Supplement. And Medicare Advantage Pathway, like may have some of the extra benefits that you just talked about, but those might be term supplemental benefits. I think we're using similar terminologies here, and then
Yes,
that adds to that confusion because now this is Medicare supplement,
correct,
and this is supplemental benefits within Medicare
correct, correct.
Advantage.
So that's why I don't call it Medicare supplemental, because that would confuse folks. So we would say extra benefits,
Extra
right?
benefits.
That
Okay.
makes more
Okay.
sense when we're
Yeah.
talking to Medicare Advantage, because saying it's supplemental benefits, I
Uh-huh.
think confuses
Few
people
list
even
people.
more because we have Medicare supplement.
Yeah.
So
Okay.
I just
Okay.
say they offer extra
Extra benefit.
benefits
Okay.
that's not offered under original Medicare, or that you could get by having a Medicare supplement plan with your original Medicare.
Medicare. All right. All right. Awesome. Awesome.
That
This is
helps?
good. This help. Extra benefits. Yeah. This help. This help.
Okay. All right.
We come to the comparison of the
To the
plan
plan types.
the plan
Right.
types that are within here in Medicare, and
Correct.
this is can be found on the Medicare.gov website.
Hmm.
So if you want to follow through, but Ruthlin is here to break them down further for us as we go
Correct.
through them. So
And
start
so
with yeah, I'll pass it on to you,
And
Ruthlin.
so with
Just take us away.
Medicare Advantage, you're going to recognize the names. And Medicare Advantage is most similar to the plans that individuals have when they're working,
When they're
right? It's
working. Yeah.
things that you're familiar with. You're familiar with having an HMO plan or a PPO plan. So the HMO plan is called Health Maintenance Organizational Plans. And the key here is that for most of those plans, you will have to stay in network. So, meaning that if your doctor does not take the plan and you go to an out of network doctor, you're very likely going to be on the hook for 100% of that cost that
Yep.
that doctor charge you, because it's an HMO plan and you have to stay in network, right? Those plans are managed more appropriately. So you might see things where you need a referral to go see a specialist. You may see things like the cost, the carrier is going to want to um, put restrictions
Restriction.
on the different types of medications that you're taking. Fail first, step therapy. Step therapy is fail first. So you're going to see kind of utilization management happening more so under those plans, because they're managing the outcome with an emphasis on preventive, and everything else. So you're going to see those the more restrictions. So if you're someone that spends half the year in one state and another half of the year in another state, an HMO plan may not
May
work
not
for
be.
you,
Yeah.
because if you want to go see any doctor of your choosing while you're in that other state and you're registered in one state under an HMO plan, it may not work for you.
Hmm.
All right. The PPO plan, or preferred provider organization, they also have networks, but they have a split where you could, where you pay less when you stay with in network providers. However, if there is a doctor that does not take your plan, or they're not in network, you could go see this doctor out of network as well. So this is great for individuals who have some doctors, that you have a whole range of doctors, but some of them don't take that particular carrier. They may pay a little bit more or a lot more, depending on the carrier, um, to go see these out of network doctors. But at least the difference between that and the HMO plans is that you do have some option to go see other doctors who are not in network for that particular carrier. So that's the PPO plan, right? In
Yeah.
addition, in some states, not all states, those there are kind of specialized advantage plans. One of those is called a Medicare Medical Savings Account plans. Um, and the key here is that they don't charge premiums. You also must be enrolled in Part B, and there are different kind of setups in those states. So I don't want to confuse folks about
Confused.
that. You will know the MSA plans if they're offered in your state. Definitely speak to a licensed professional who sells those plans to understand the benefits between going with an MSA plan versus going with an HMO or a PPO plan, because there are some restrictions there as well too,
Okay.
right? But also some flexibility. So folks want to be able to do that as well.
Okay.
Um, and there are, just like the MSA's plans, there are what's called private fee for service plan. It's exactly what it is. Fee for service. The doctor has to take the plan, agree to take the Medicare allowable rates, and they get compensated based on a fee. That part of the structure, but it's a advantage plan. So there are certain rates and premiums that an individual charges as well,
Hmm.
um, that an individual pays as well. And so those two, the private fee for service plans, the medical savings account plans, they're not offered everywhere. But in the states that they are offered, and if you want a list, we could send out a list at a later date as to which
Or
states those plans
can
are
you reach
offered
out
in.
to us?
Um, but in the states that they're offered, individuals are aware of them because they're part of the larger packet.
Hmm.
All right. And then there's another type of Medicare Advantage plans that individuals have to be aware of, because we see them a lot, and we hear a lot of commercials about them. And those are called the special needs plans. And there are three types of the special needs plan. There are the dual plans, dual special needs. Those are for individuals who have Medicaid and Medicare. And you will know those because when you see the commercials, and the commercial says you could have an OTC, and you could have meal benefits, and you could have and OTCs are in the hundreds of dollars. Chances are it's a dual special needs plan. They're going to show you must have Medicare and Medicaid. So you got to read the fine print, or listen for those keywords, Medicare and Medicaid, when you're talking about a dual special needs plan, because that's who's eligible for the special needs plan. In addition, there is what's called chronic special needs plan, and those are for individuals who have two or more chronic condition. And in many carriers that offer chronic special needs plan, they will have the disease groups that will be eligible to participate in a chronic special needs plan. So it might be things like you have high blood pressure and diabetes, or you have
Mm-hmm.
chronic health challenges, or you have blood clotting disorders, right? They will specify who amongst the Medicare audiences could participate in a chronic special needs plan. Not every carrier offers a special needs plan, a chronic special needs plan. Um, it's not offered in every it, and I say not every carrier. It's not offered in every
Understand.
area.
Okay.
I'm based in New York. We don't have a lot of plans in the New York City area that are chronic special needs plan. We have lots of dual special needs for Medicare and Medicaid. So it's important to watch the language and what's being offered when it's being discussed as a special needs plan. And then the third type of special needs plan that's offered, Prince, is called institutionalized. So when someone is in an institution, a skilled nursing facility, a nursing or some kind of other facility where they're institutionalized, they could actually go onto an institution uh, plan because maybe that institution takes that plan versus the one that the individual have. And I'll give you an example because the institutional one gets a little confusing for the individual sometimes. So I have a customer. She called up and she said, um, Ruth, she was in a, I guess it would be a skilled rehab facility for like about 5 months.
Okay.
She fell as an older person, so she fell in her house, and she had a particular carrier, and she loved that carrier, right?
Mm-hmm.
But then she was in the institution. She was there for a long time, and they moved her to an institutional plan. But they didn't. When you're on an institutional special needs plan, once you come out, you actually could be on that plan for a few months afterwards. But
Okay.
now she was so used, she knew her old plan and she came out and she didn't have the benefits that she always had anymore. She
Okay.
didn't have her she had a large number, she had a large OTC. So she's using the plan and she's going to the pharmacy to get some of her OTC products, and she couldn't access that, and she came really crying asking,
What
"Oh, I don't
happened?
know what's going on. I had this plan. I'm trying to use my plan. I can't get my Medicare. I can't get my OTC products, and I need my OTC. It's costing me a lot of money for that." And we had to do some investigation to realize what's happening. And what happened was that while she was in the institution,
It
they
has
moved her to an iSnip. But now that she is out, we had to move her to
her
a more
back to her more
appropriate plan so she could continue to get the benefits that she was used to
use
getting.
and used to get in. Yeah.
Right? So those things happen because interchanges happen all the time across the Medicare Advantage plans.
Hmm.
And that's where, so folks have to be very knowledgeable, cognizant of the fact that um, you know what those plans are that you might be in and what you're eligible for.
Yeah.
Now, as an agency, when it comes to Medicare Advantage, we're all about having the individual in the right plan for them, right?
Mm-hmm.
So if someone has Medicare and Medicaid, right now we're going to look to try and have them in a Medicare Medicaid dual
These.
special needs plan, right? Because they have that access, it lowers their cost that they will pay out of pocket. So that's more of an appropriate plan cost wise for them. It's not that we can't keep them in a Medicare supplement. It's not that we can't keep them in an HMO or put them in a PPO, but the dual plans are going to save them more money
More
that way.
money.
But it has to work still, right?
Yeah.
So
Yeah.
I can't put an individual in a dual special needs plan if their doctors are don't take the dual special needs plan, right? That's going to defeat the purpose, right? Because now they're going to call, they're going to complain, they're going to say, I hate Medicare, this is not working. And a lot of times it's just these plan selections. So if you understand the type of plan that you do have,
Mm-hmm.
Medicare Advantage could work
What for
very
you?
well for individuals.
Okay. Okay.
Okay.
So, Ruthlin, and I'm doing this because
Break it out.
when we are, when we're going through the traditional Medicare pathway
Right.
and looking at the parts A, B, D, and then describing all these things, brain was like, okay, all right. Now you have something that is rolled everything rolled for you
Into one.
into one for you in some way. But then you still have to know which one specific lane within this Medicare Advantage pathway that works
Right.
better for you, either HMO, PPO, MSAP, a private fee for service, or SNP. And then
Right.
within SNP, I SNP, D SNP, whatever. What was the other one? C SNP, I SNP. Yeah,
Snip,
so
I
you have to
snip,
also know
D
which
snip.
one that better will work for you. But ultimately, I think the choices from the traditional pathway through the Medicare Advantage pathway also pretty much correspond to the vast of 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 uh,
Choices
of
that individual.
choices and differences and all the other things that goes on in the back. But then it's
Correct.
also so knowing which one works better for you as an
Correct.
individual and how you can better leverage that for your use case.
Right.
Yeah. Okay.
And so, Prince, if you remember where we started on week 2, where we
Hmm.
spent some time drilling down how do you select a plan,
Yes.
that more than anything else relates to Medicare Advantage plans.
Yeah. Okay.
It is crucial. So you have 42 plans, 42, right?
I
43
think it was 43
average,
on average.
right?
Yeah.
Right. Some people have a lot more than that, but you have 43 plans on average to choose from. How do you choose a
How
Medicare
do you make
plan?
a choice? Yeah.
Right. It is most important that you start with your doctors because
Okay.
it's all about the network, right?
Hmm.
And we do process of elimination, right? We're looking for the vast majority of doctors in network, right? And in network in the HMO plan, in network in the PPO plan, if that's offered, in network in the dual special needs plan, if that's offered. We want the doctors in network because that's how the individual is going to save money.
Hmm.
It's the difference between paying $20 or no, well, let's for a primary care physician, it's the difference of paying zero to go see a primary care doctor
Hmm.
versus $50 if you're in a PPO plan, give or take. It could be higher, it could be lower, but the difference of paying $50 because that doctor is out of network,
Out of
or
network
20% of the charge because that specialist is out of network.
for
So with
co-insurance.
Medicare Advantage plans, and agents are required to go through and ask the individuals and trying to align the needs to do a needs analysis on the consumer to make sure that they're checking the doctors, they're checking the medications, they're even checking the pharmacies that the individual like to use, because it all has to be, the medications have to be in formulary,
Hmm.
the pharmacies should be in network
Network.
or maybe a preferred pharmacy for that particular carrier. And we want to see the doctors taking those plans,
Hmm.
right? If they're not, and you put them in an HMO, they're not going to have, the individual is not going to have the right access. And they're going to complain because every time they go to see the doctor, they're shelling out money that, and they're going to hate, as many consumers say they hate Medicare. I don't like Medicare. My doctors doesn't take it, and that's because the due diligence didn't happen.
Didn't happen.
So it cannot be rushed. But there are lots of issues with Medicare Advantage. It cannot be a rushed process when someone is confused. You have to make sure that the consumer um, understands the choices that they're making, um, that they understand that Dr. X is not going to be in network. And
Hmm.
if they're still making a choice with the HMO and knowing that Dr. X is not in network, then they have to know that they may have to change that doctor,
Oh, yep.
right? But I don't start with changing doctors. I want to make sure that the consumer knows which doctors are in network and that they've prioritized the number of doctors, the doctors that they must see
Hmm.
versus the ones that they see once every 2 years or they've seen 5 years ago, but they give me the whole list anyway because they've seen that doctor. um, so we want to make sure that they're making good decisions, that they know that those doctors, those providers, and it's not only doctors, right?
You know.
It
Hmm.
is the labs that
The
they
labs.
use, hospitals that they like to go to. Want to make sure that those entities are in network, and that we prioritize the list of who they must have versus who they could possibly change, and then we start doing that. But we always start with the providers with Medicare Advantage.
Okay. Okay.
Otherwise, it won't work for an individual.
Any individual. Yeah. Yeah. Thank you so much, Ruthlyn, for breaking this down. At least I'm just looking at the time as 40 minutes in, and you can just imagine we haven't even talked about the premium and
Okay,
how
so
that relates to this. You were just explaining
okay,
this section for us,
I
right?
was just
You were just
explaining, but
explaining this section.
I'm gonna move ahead now because there is one thing. So the premiums we're gonna talk about, and we're also gonna talk about who's eligible for Medicare Advantage plan,
Okay.
because there is some confusion about that as well. So the premiums on the Medicare Advantage plan, they span the gamut. They will start at $0, meaning that, and so the individual must maintain Part A coverage when it comes to Medicare Advantage plan. So they must be eligible for Part A, and they must be enrolled in Medicare Part B. So Part A meaning hospital coverage. So they must have that. They must be enrolled. So if you're not actively enrolled in a Medicare Part B plan, you can't get a Medicare Advantage plan.
Okay. Hold
All
on.
right? Got it?
So there's eligibility, there's
There are eligibility
enrollment,
rules. Yes.
eligibility rules, enrollment, and then you select and the selection of
Right,
this.
right.
Okay.
So
Okay.
remember when we spoke about how someone coming in and they enroll in original Medicare, everyone starts with original Medicare?
Yes.
That's where everyone starts. So they're enrolled in A, they're entitled to A, they're enrolled in Part B, right? And
Hmm.
now they're making the choice of going in the
In the
pathways,
pathway.
right?
Okay.
And once they make the choice for going into a Medicare Advantage, that includes they still pay the premium for Part B. So whatever your premium for Part B is, this year is $164.90 as the base for Part B. That's the
Hmm.
starting point for people on this making under $97,000, right?
Okay.
And then, but you pay the premium for for Medicare Advantage on top of the Part B,
Okay.
right? Only the premiums starts from $0 premium, and then
Hmm.
it goes up from there,
Okay.
right?
Okay.
We have plans in the New York area that goes up to over $200, right?
Hmm.
People love. I have many consumers come to me and they love the $0 plan. They don't want to pay any extra,
Sure.
and I have to take the time to sit with them and let them know that as what with all things with insurance, the lower cost comes with higher out of pocket,
Out of pocket. Yep.
right? So sometimes I have to convince someone because, and I don't get paid to different if I put someone in a higher plan versus things. So it this is not how we get paid. But sometimes for some individuals, when they're complaining about costs, it is important to explain to them that if you're complaining about costs and I could reduce your costs, sometimes it makes sense to put the person in a $30, $40 plan that I know that they could afford, right?
Hmm.
Because we've spoken about their needs and their bills and whatever else is going on in their life. But sometimes for some people, it makes sense to put them in a $30 plan to keep the copays down than to put them in a $0 plan,
And then
right?
with
But
that.
everyone comes and they say, I don't want to pay extra. All right. And so these $0 plans, which we have a lot of, they look good on paper, but it does not always work for everyone. So it's
Everyone.
so important to evaluate across those plans as well, Prince.
Okay.
All right. So that's the premium on the Advantage. It is $0 and it goes up from there in terms of premiums that the individual will pay on those plans. And
Hmm.
that is on top of the Part B premium. and that could be taken out of Social Security payments as well.
Oh, so it's on top of the Part B premium.
Correct. It's on
Okay.
top of the Part B. So
Okay.
if you have a Medicare Advantage plan and your Part B premium is $164.90, and you select a Medicare Advantage plan that comes with a premium of $20,
Mm-hmm.
you're going to see on your Social Security statement that it was 164 taken out for Part B and
And then extra
$20 taken out for that
for the
Advantage plan and sent to the carrier,
the career. Okay.
right?
Okay. That's good to know. That's good to
That's
know.
good
It's on
to
top
know,
of it.
right?
Yeah.
So it's on top of,
Okay.
not beside of.
The sign off. Yeah.
Right? Because I think a lot of folks believe that, oh, well, if I take an Advantage plan and it's advertised at $0,
$0
that I
then
don't have any extra costs other than my co-pays. But you do have to take it up. You have to maintain Part B.
yeah. So it's on top of the Part B premium, and then the out of pocket costs also come on top of it. So
And then the
all of
out of pocket costs,
top.
so your co-pays, your deductibles, if
All
there is a deductible
yeah.
in the plan, your co-insurance, meaning a percentage of the cost for some of the services that you will get. And so, especially in the out of network services,
Mm-hmm.
where individuals could see 50% in the cost that they're going to pay for a provider. So
Mm-hmm.
that's why it's so important to maximize the number of providers being in network.
Yeah, yeah, quick. Okay. Okay. All right.
Hmm.
So if you're done with the premium, we can move
Yes.
on to the next one, which is the drugs.
Okay. So many of the Advantage plans come integrated with Part D coverage, right? Now,
Mhm.
with Part D, even though it's integrated into the plan, the individual consumer will notice that with Part D still has its own um maximum out of pocket limits, right? What's often called the true out of pocket limits for Part D. So Part D have its own premium. Well, not its own premium because it's now integrated into the plan, but it
Mhm.
has its own out of co-pays that the individual pay that's often separated out and not included in the maximum out of pocket that we spoke about before, right? I just wanted to correct that.
Okay.
But so with the Medicare Advantage, there are plans that comes with just Medicare Advantage, so all of the extra benefits and no prescription drug coverage. And there are plans that come with the prescription drug coverage.
Okay.
All right. Um, and for so that's the plan someone chooses. So people that will put in a drug in a MAPD in a
PD.
Medicare Advantage plan um, without drug coverage are people that have medication coverage elsewhere.
Okay.
Maybe they have it through their old job that continues to provide a creditable coverage for prescriptions. So
Okay.
all they need is just
The medical.
the medical benefits from the Advantage plan. They don't need prescription drug coverage. If they do need, but the vast majority will go into Medicare Advantage plan
Okay.
with drug coverage.
The drug
So with
coverage.
the HMO plans, if you join the plan and it doesn't offer drug coverage, you can't get it separately,
Hmm.
right? Um, with the PPO plan, and this is, and I think I was kind of clarifying that before, but with the PPO plan, if you join and the plan doesn't offer a separate coverage, you can't get it.
Hmm.
So that's why it's so crucial to know who's getting the prescription coverage because not having prescription coverage comes with a penalty,
Wow. Okay.
right? We discussed penalty way back when, right? And this is one of those cases where there's a term Medicare uses called creditable drug coverage. So whether you choose a PPO plan, whether you choose an HMO plan, if you don't take prescription coverage, you have to have that drug coverage elsewhere that
Elsewhere.
is comparable to what Medicare offers.
Okay.
All right. So that's why I say some plans come with it and some don't come with it. And if it doesn't offer it, then you can't get it,
Hmm.
right? So that's just important to know. If someone joins an MSA plan, they have the option to choose how they will have their drug coverage covered. And so they could get the Part D coverage through the plan or outside. So they'll have the option to join a separate drug plan, so to
Okay.
speak,
So
right? So they'll
that
buy a standalone Part D plan.
so MSA can join a standalone Part D
They
plan.
could join a standalone Part D plan.
Okay.
Take a swipe of water.
Yeah, yeah.
Okay,
Please stay hydrated.
right? Um, so the fee for service ones, the fee for service options, right? Um, some of the plans may offer prescriptions, some won't. So if your private fee
Fee for
for
service.
service plan, it's like a tongue twister,
Yeah,
doesn't
PFS.
offer drug coverage, you'll need to join a separate Part D plan.
Mm,
All right. And you understand the difference? So the MSA, you have the choice of which one to go with. With the private fee for service, basically, if it's offered, you have to take it. If it's not offered, then you will have to go through and get a separate plan. All
yep.
right.
See the difference? Yep.
Now the dual plans, I have yet to see. It's not that it's not possible,
Is it the
but
dual or the SNP ones? Are you specifically mentioning about the dual
correct.
SNP?
So the
Okay.
the special needs
Special needs plan.
plans, they all offer prescription
Part D
drug
would.
coverage.
Okay. So either the dual D SNP or I
Mhm.
SNP or C SNP.
Correct.
Yeah.
They all come with integrated because they're more managed. So
Mm-hmm.
they all come with prescription drug covered internally in those
Internally.
plans.
Okay.
Let me give you an example of the HMO and the PPOs that do come without drug coverage. We have many military vets, and they have prescription coverage that they could go over to the VA and get their meds covered. So if they have medication covered through the VA, then all they need is just a Medicare
Medicare.
Advantage plan with the extra benefits that will help them cover the things that's not covered through the VA. And so most of what we offer in terms of like HMOs without prescription coverage, we're targeting the vets. HMOs and
Hmm.
the PPOs, we're targeting the vets who may have some coverage through the VA, or people who have former employments that continue to offer their retirees prescription coverage.
Okay.
All right.
Okay.
But
That's a
for the
good
vast
example.
majority, you need a plan integrated with Part D for
Okay.
all of those.
For all of them. Okay.
All right.
Okay.
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 Got
Yeah.
5 minutes.
Oh yeah, we got 5 minutes. All right. Providers.
So I think we've exhausted that. So what I'm generally going to say is
Yeah.
that for your HMOs and your PPOs, um, you pay less if your doctors are in network.
Yeah.
With the Medicare medical savings account, the doctors don't generally have to be in network. But what you will find is that they do agree to accept Medicare.
Okay.
Well, this is the private fee for service where they agree to pay accept the Medicare account,
Account. Yeah.
right? The Medicare payment term. Sorry. But with those two, the doctors, they may be in network, they may not be in network. But at least there is an agreement that they will at least take whatever the carrier is offering them. And if
Okay.
they're not, you're going to want to think carefully about joining an MSA plan
Yeah. Okay.
or a
Okay.
private fee for
Fee
service
for
plan.
service. Yeah. And for the snaps, um, you know, plans
So
in
with
network.
the dual special needs plan, they do offer, it's just kind of a type of category, but they do offer HMO and PPO plans, right?
Oh,
So
within the snaps.
within the SNPs, they're all HMO or
Oh,
PPOs.
PPO. Okay. So then
So
it goes through the same
they go
how
through
they
the
are.
same they go through the same process. It's just a different type of those things. So but remember, it's tied now, as for someone with a dual, it's tied to Medicaid. So you would want to make sure that the doctors are in network,
network.
especially on the HMO plans.
Huh.
Right?
Yeah. So with that, you were thinking through like the doctor in the Medicaid and the Medicare, accepting both of them because then both of them are paying for the
Right.
coverage.
But the doctors in the special needs plan, especially in the dual plans, they've agreed
Agreed to do that.
to
Okay.
accept or being under contract with the
With both of
carrier.
them. Uh-huh.
But we find a lot of areas in that that's kind of gray
Huh.
on the because we see doctors when we check the formula when we check the list we see doctors on the list who say they're in network, and then the member will go see that doctor, and the doctor will say they do not take the plan. So there's a lot of contracting issues on the background beyond all of us, beyond the agents, beyond the consumer, that's happening on an ongoing
Ongoing
basis,
basis.
that there are changes happening across all of these plans. The doctors are in, they're not. Yes, they take it. No, they're not.
Noted.
Sometimes the office doesn't even know that they're
The
signed
doctor
up
has
for the visit.
changed.
So understand why there are so many challenges with the
Challenges.
consumer
Yeah.
in
Yeah.
that piece. But the whole idea is for providers and hospitals, you want to make sure that with the Medicare Advantage plans that they're at least in network.
Okay. We will move to primary care. I think it goes over some of the providers. Do I need to
Okay.
choose primary
HMO, yes. For the most part, most of the HMOs, because everything is in network. For the other types of plans, you don't
care?
necessarily have to, but it's generally good to have a
The
primary care
primary care.
provider.
Yeah. 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 All right. Then the referrals.
Okay. For the HMOs, generally, yes, not all plans. In fact,
Mm-hmm.
we're seeing a lot of HMOs moving away from having a referral to see a specialist. Um, but you will find many of them still do have that referral to see a specialist. But for the others, you go see the doctor of your choosing.
No. Okay. 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 Then I think that is the last one we have for today. It's been amazing. I haven't received any of our areas, but definitely I'll be sharing out a link. I'll be putting a link in there, and you may please reach out to us either if you have questions for today or you have questions from later. We know people will be watching these videos later at a later time, but please reach out to either Ruthlyn. Check the website out at healthwithsolutions.com. Reach out via email at support at healthwithsolutions.com, or reach out to me on the Heals Academy .com or info at the healsacademy.com. But it has been an amazing 5 weeks. I can't even imagine we've gone through 5 weeks of this, and there is so much, much, much more to share. But definitely, within October, and even this is the first week of November, it's been a great blessing to me, Ruthlyn, having you around to share your knowledge, to share your expertise, to share the stories, and seeing how we, our audience, can better learn and know that they don't have to do this by themselves. We don't have
Right.
to do this by ourselves, but there are licensed professionals that are there. And with some education, you're able to reach out to them, you're able to discuss with them. When you're talking, you can now say it's a PPO, D snip, C snip, D snip, I snip, you can talk through some of these things. Or when they mention these
Right.
terminologies, at least you have an idea where they are taking you based on your need. If you go prepared, you are able to help the person helping you even get to the right place easier. Just like using a
Right.
GPS and knowing how to use a GPS versus getting a GPS, a phone with GPS on, and you don't have to use a GPS. Even with the navigation, you still don't know how to use it better. But with it, with
Correct.
your knowledge combined, you are better aligned to better make the right choice for yourself, for your family. And it's been a great, great, great 5 weeks. we'll take a break a bit, right, Ruthlyn?
Yes,
And
sir.
we will pretty much reach out, like as I said before, if there is anything that comes to mind, please don't hesitate to reach out. Check out our websites. And Ruthlyn, I'll pass it on to you while I quickly pull out the link and share on our on the site.
Sounds good. Well, all I could say to you is that if you're a Medicare, if you're a buyer, so to speak, so you're the consumer and you're looking to make your Medicare choices, the best way to stay ahead of the curve is to be prepared.
Hmm.
Prepare your list of doctors, prepare your list of medications. You don't know how far those things could go in helping you make well informed decisions about the type of coverage that you would need, and know your budget, know your limit, right? If you understand how much you could afford to pay or can't afford to pay, and I mean in real dollars,
Hmm.
um, but if you know how much you could afford to pay, then you will make a decision as to whether it's Medicare, original Medicare with a Medicare supplement, or whether it's Medicare Advantage. They both have their strong suits, both pathways have their strong points. They both have negative points, but somewhere in the middle, you could figure out what works well for you,
For you.
um, and make it work for you.
Thank you so much, Ruthlyn. As I said last week, you don't get the Medicare you expect. You get the Medicare plan that you inspect. So take the
Correct.
time and review things with professionals, people that have some much more knowledge, and reach out, and we can better navigate you to the right place that you need to be. And it's been a delight. Thank you for joining us for this hour. Thank you for joining us for several hours. Thank you for watching, and we'll take a break a bit for Medicare Mondays, and we'll come back with some more series, if even if it's asynchronous, seeing how best we can get this to our audience. And if there are any specific questions or specific areas that you want us to cover as well, please don't hesitate to reach out to us, and we'll
Mm-hmm.
do our very best. Bring in several professionals on board to discuss and talk through some of these things. And we sincerely appreciate you, and we'll truly miss this, but we are all here to learn, and we look forward to more things that are coming. All right, so we'll say bye for now, and I can't even imagine next week Monday not having Medicare Mondays, but it's a delight. It's been a delight here. Thank you so much,
Thank you for
Ruthven.
this great
Again,
partnership.
yeah. All right. So bye, our audience, and we'll keep you all posted within the next coming weeks. All right. Thank you, and bye bye.